as we often think in terms of people's health care, if you think about it in terms of helping people in healthcare organizations, wouldn't it be more effective if we caught this earlier? And inevitably, people in medical schools throughout the world are beginning to spend a lot of time in their courses on clinical practice, professional practices, or special empathy courses saying, how can we teach our medical students to deal with each other as human beings, to start to be able to interact with the patient, not just as a disease-bearing platform, but as a human being. And there is a concern that we should do this. The problem is, as Howard Becker wrote in his key book, Boys in White, in 1965, that most physicians come into medical school wanting to be a healer, and by the time they get to the end of the first semester, all they can think about is passing tests and passing courses. And apparently that focus on the rites of passage, on the hoops you have to jump through to get your accreditations and to enter the field, the profession, continue right through internship and residency. So the dilemma is we have to counter this huge force that moves physicians toward, or medical students, I should say, towards the more stress-induced aspect of making it through, of not just doing time, but actually maximizing learning and learning retention. And this is where we hope, we believe at this point, that an increased amount of attention to these things that we might call emotional intelligence training, mindfulness training, resilience training during medical school might really help a lot if they're reinforced throughout the 4-year process. If they're just done once, it's not going to have staying power. If they're reinforced, and they're reinforced in the internship and residency. I know you're saying with all the other things that we have to do, how are we going to find time to do this? Well, if you don't, the retention of a lot of the other things you go through is very low anyway. And this might help increase the retention. So it suggests that we could have a very positive and long-term effect if we could help medical students. It sounds odd and being more human, but focusing on both the default mode social network and the analytic network while they're in school, and teach them to cycle back and forth appropriately.